Hello listeners, September is Sepsis Awareness Month and September 13 is recognized as World Sepsis Day. What is sepsis and why it is important to know about sepsis? I will try to explain in a very simple language so that it will be helpful for all of us. Sepsis is a medical emergency. It can kill you if you don't get treatment immediately. It is a serious and common complication of any infection. In this condition, body attacks its own organs and tissues, which can lead to tissue damage, organ failure and death. Sepsis happens a lot. It kills more people than breast cancer, AIDS and prostate cancer combined. According to one data, sepsis takes lives of more than 18 children each day, more than a childhood cancer. It is an emergency, but it is preventable and treatable in most cases using existing protocols. Who is at risk of sepsis? Anyone can get sepsis, but some people are more susceptible. It can occur at home or in healthcare setting. Some members of the public perceive sepsis as only a hospital-acquired condition, but actually sepsis begins outside of healthcare settings for nearly 80% of patients. More vulnerable are patients who have been in hospital, prolonged hospital stay, prolonged admission in an intensive care unit, people with bad burns, people who get infection easily, for example immunocompromised patients, elderly, children, people with chronic conditions like diabetes, liver disease, chronic kidney disease, people with invasive devices, tubes or drains, patients who have open sores and cuts. Prolonged uses of antibiotics and corticosteroids can lead to sepsis. Now, how do you know if you have sepsis? There are some common signs and symptoms which you can identify easily. Shivering, fever or very cold temperature, temperature greater than 101 degree Fahrenheit with shaking chills or very low temperature, less than 96.8 degree Fahrenheit, extreme physical pain or discomfort, pale, mottled or discolored skin, sleepiness and difficulty in walking, disorientation or confusion, hard to breathe, shortness of breath and rapid breathing or very low breathing, elevated heart rate and or low blood pressure. While in children, the child feels abnormally cold on touch, looks mottled, bluish or has very pale skin, has a rash that does not fade when you press it, very fast breathing, has convulsions, is very lethargic or difficult to wake up. What to do if symptoms of sepsis are present? You should contact medical facility or your doctor immediately. What are the methods of prevention of sepsis in community? Early recognition and treatment is very essential. It includes prevention, knowing the symptoms. Patients with chronic conditions should take more precautions. They should get recommended vaccines timely.